Today, I want to speak to the part of you that's ever felt voiceless in a hospital room or in a hospital setting. The part that wanted to ask more questions and didn't know how or when. The part that nodded quietly even though you were confused or afraid. You're not alone. I've seen it. I've seen patients rushed into decisions, overwhelmed with medical language, big words that the doctors won't break down, or concepts they won't break down, or made to feel like they're being difficult for wanting clarity and a better explanation of things. And I've also seen nurses and doctors burnt out, doing their best inside of a system that doesn't always support communication or proper consent. I've experienced this both on a patient front, at being a patient after surgery, and also being a student and in the learning capabilities of these environments. This video isn't to blame at all. It's about empowerment, about patient empowerment, and I want to walk you through how to advocate for yourself in these types of medical settings and how to ask the right questions, what informed consent truly is and what it means, and how to protect your voice when it matters the most. But before we dive into this, a quick little disclaimer. This video is for educational purposes only. It's not medical advice and it doesn't replace the care of your provider. So I also want to acknowledge something important. Many patients are being dismissed, ignored, or even harmed by the very systems that are supposed to care for them. And at the same time, many healthcare workers are exhausted, under pressure, and doing their best. Both realities can simultaneously be true. So this is not about shaming doctors or demonizing hospitals or nurses. It's about clarity, dignity, and remembering that you have the right to understand what's happening to you, your body, your health, your family members' health that are at the hospital. Starting with something that sounds super basic and something that you think would be performed all the times to the best of its abilities, but sometimes it can get bypassed, is informed consent. So informed consent means that before any sort of treatment, procedure, or medication, you have the right to understand what's being done, why it's being done, what are the risks and side effects, and yes, you should ask more into this one specifically, even if they say the benefits outweigh the risk. What are the alternative cares that I could possibly do, including doing absolutely nothing? And you also must be given enough time to decide without being pressurized. And this isn't a courtesy. This is legal. This is ethical. These are your rights. So when you're in pain or scared, it can be hard to ask questions. But the law says that unless it's a life or death emergency, consent must be informed and voluntary. That means there should be no guilt tripping, no rushed, let's get this done quick as possible without an explanation, or this is the only definitive way. And definitely no, you wouldn't understand kind of dismissiveness from a physician, a doctor, or a nurse. So let's dive a little into a few tips. So if a provider is rushing you, it's okay to tell them, hey, can you slow down for a second? This is a lot of information to process for me, and I just need a second. You can also ask, can I take a moment to think about this or talk to a family member? You don't have to make decisions right away unless it is a life or death situation, but most of the time you have 5 minutes, 2 minutes that you can collect yourself and gather your thoughts, or talk to a trusted loved one. Or you can also say, I'm not ready to say yes yet. add that in. You don't have to cater to the provider in a sense. Like, you can take your time to make these decisions, and your no matters just as much as your yes, and that is real consent. While we're on this topic, I want to plant a seed for something called an advance directive. It's a legal document where you get to express what kind of care you do or don't want if you become unable to speak for yourself or have the cognitive abilities to make decisions in a hospital setting. So this is a legal document that you create. It might include things like if you want life support, who would you trust to make decisions for you if you were unable to make decisions for yourself? What your wishes are if you were to be unconscious or terminal. And you don't need to be sick to make one of these. It's actually a radical form of self-advocacy, and it makes sure that your future aligns with your values and you're not putting this pressure on your next of kin or your family members if you also feel like they wouldn't uphold what you would want in that setting. They would want you to live a little longer than you wanted to if you were in a vegetable state, things like that. So it gets you thinking about it, all of that. All right, so now let's talk about the real world stuff. What do you actually say when you're in the room with a provider, with a doctor or nurse? I always tell patients, curiosity is not rudeness, and questions are not disrespect. And if your physician or your medical team ever makes you feel like this, you can ask for a different person, a different provider, because these people should be able to explain to you in layman's term of what is happening. So you can try asking them, hey, sorry, that's toffee. Ask them, what is this medication for? What are the risks? What are the side effects that I should know about? And even if they say the benefits outweigh the risk, still ask what the risks are. Still ask again what the side effects are of possible known side effects. Like, these are things that they should know and or be able to research and get back to you on. And that is part of an informed consent, to know all of these things and not bypass it by having that said to you that the benefits outweigh the risk alone. Are there any non-drug options for this? Can this wait? Is it super urgent that I need to have this procedure done or be on this medication? Sorry, what would happen if I do nothing for now? Like, would my situation get worse, or would it stay the same? Can it improve over time? And if they're just explaining your lab values and all of that, or like your MRI, they're just telling you what they see, you can also ask to see the results of the tests in writing. You're allowed to have those documents for yourself also. Is there a patient advocate I can talk to especially when you're having tougher conversations with providers and healthcare team and they aren't really on your side or making you feel a little more dismissed and all of that? You can ask for a patient advocate who works at the hospital, who knows these people and can be that buffer or the middleman when things feel a little more heated. And you also have the right to ask, can someone explain this to me again in plain language? Because medical jargon, medical language is a whole nother language, and it can be difficult to try and understand for someone who doesn't have any background knowledge in anything medical related. And if you're not ready to decide, instead of just nodding and saying yes, because you think that they're expecting an answer right away, can I take 10 minutes to process this and call someone that I trust, and then I can let you know? I'm feeling very overwhelmed right now, and can we just pause for a quick few minutes? Let me process everything that I've heard, and then let's continue this conversation. And saying any of these things isn't a weakness. It doesn't suggest that you don't know things or anything like that, or you to make you feel dumb or anything like that. It's wisdom to pause and reflect and process before you proceed to the next steps that may feel scary. Maybe you've been there. Your gut tells you that something's off, but no one's listening, or the room feels like it's moving way too fast. It feels too sterile and too unfamiliar. If you feel like your voice isn't being heard, these are some tools that you can use to kind of help alleviate and make yourself advocate for yourself a little bit better and alleviate some of that anxiety and tension. So if the tensions are too high and your provider isn't speaking to you properly and making you feel dismissed, you can always ask for another provider. Is there someone else I can speak with? You can ask for a patient advocate. You can request a social worker if there's a social worker in the hospital setting, but a patient advocate is like a perfect little buffer in between, and they usually are really good at breaking down that language barrier from like the medical language to just plain language. And you can name the experience. I don't feel heard right now. Can we slow down? And that is a very valid thing to say to your provider if they are being a little hotty-shotty. Okay, you can take some space. Even a 5-minute pause can bring a lot of clarity. If things are getting heated, it can cool the provider side and them down, and for yourself. And there's another like little powerful thing that you can do and can make you feel like you are back in power of the situation. You can write what happened down. If something doesn't sit right, write the date, time, and who you spoke to and what happened. This creates a record, first of all, and a sense of empowerment in a space where you may not otherwise feel like you're being heard, and you may feel small. And you're not being dramatic. You're being responsible, and your body is worth protecting, and or your families. And finally, I want to say this. While patients are being neglected in some of the cases, many nurses and doctors are under such incredible strain and stress. Overworked, long shifts, short staffing, trauma, burnout, and each nurse, if you're in a bigger unit, each nurse is given certain amount of patients that they need to rotate through, and sometimes it could feel like other people are getting more time than you or more care than you, but they have to make equal amount of time for all their patients. And if every other patient is asking for a little bit more time or a little bit more care, you can see how that throws off the balance of how the nurse is supposed to move from one patient to another to kind of allocate proper time to all the patients. And the pressure on the staff also should never mean pressure on the patient. So if someone is having a bad day from work stress or whatever, it shouldn't be something that's passed down to the patient. When we remember that this environment of a hospital setting is human to human interaction and not just a system, something shifts. We stop being passive and we start being present and advocating for ourselves. And that these people picked a profession that is supposed to care for people, have compassion for people, and empathy. And although I can relate with providers, doctors, nurses, and whatever, because they go through such a high turnover of patients, they don't see the patient as a human anymore. They just see it as like another person to like get out throughout the door or whatever. And it's taking that time to like slow things down to remind them that you also are somebody who has feelings and is here in the hospital setting scared, and like maybe for your first time post-surgery, let's say, right? Like you don't know what to expect or what to do. You're relying on your healthcare team to be that leadership role to let you know what to expect and how things are going to go and how things are going to run. And that is their job. They signed up for these roles. This is what they're trained to do. And if they're not doing a good job at it, And that's when you put things that I've talked about in this video into practice. You start advocating for yourself in the situations where you feel dismissed and where you're not being heard, and or they're making it feel like they're doing you a favor by taking care of you and all of that. Understanding that they are tired and burnt out and they have a lot of patients to take care of, but also not to lose their empathy and compassion, because you are here to take care of someone. You are here to help somebody, and that's the reason most nurses and doctors will tell you the reason why they even got into medicine in the first place. And if you're not doing the very thing that you set out to do, then like, what are you doing, you know? So, if you've ever left a hospital room feeling confused, ashamed, or even unsure of what just happened, please, please, please know this. Your body is not a burden. Your voice is not too much. And you deserve time, you deserve an explanation, and you deserve proper informed consent. And if no one's ever told you that before, let me be the first. You deserve to be understood, you deserve to ask, and you deserve to heal with dignity.